This is Doug Field along with my co-host Ron Bachman, and welcome back to this segment, Healthcare Consumerism Radio. And, Ron, in the first segment we were talking about telehealth and the Alliance for Connected Care started by the senators and, where we think that's going to really serve an important need in this marketplace, telehealth. And joining us is, one of the leading proponents of telehealth, Jeff Marks, CEO of HealthPERX. Jeff, good morning.
Hey, good morning, Doug.
Hey, good to have you here with us. Jeff, for our audience, give our audience a quick background or an overview of HealthPERX, please.
HealthPERX? HealthPERX is a health and wellness marketing company that essentially features telehealth as a core benefit. And, it's a non-insurance product, and it fills in a lot of gaps in today's day and age, being that all the rules have changed in healthcare, and got a shortage of physicians, longer waiting times, more people in the system, higher deductibles, sort of a perfect storm for innovative solutions, and that's what we're tapping into.
Yeah, and you just announced an interesting new partnership. You want to tell our audience about that? What you're doing with?
Well, yeah, we did. You have to understand a little bit more about telehealth, but our telehealth program gives people immediate access to doctors nationwide who can diagnose and treat and prescribe, if necessary, acute, minor, routine illnesses. And then we partnered with eDoc America, which is sort of like WebMD on steroids, which allows people not to get a diagnosis and treatment and prescription, but to communicate with doctors and specialists and fitness trainers and dietitians about any kind of health care needs so that they can really educate themselves, in general about health care, not necessarily something that they need to be treated on today. So sort of complements, it's an expansion of telehealth to give people more information.
Yeah, congratulations for getting that done.
Jeff, Ron Bachman here. Tell our audience a little bit more about what you call telehealth, telecare, telemedicine. All these terms are developing in the marketplace. Is there any difference between any of those, and is it all always online?
No, I mean telemedicine. I'd say is the industry term. A lot of people have been hearing over the years, and telehealth seems to be the term that is evolving and being recognized actually by state regulators as the type of telemedicine in which you talk to a doctor by phone or online or your smartphone app, where telemedicine will be, when doctors are in a remote area on a high-def TV looking at what's happening from here to there or passing files. So in our case, we have a network of doctors nationwide that are available 24/7. So, no matter where you are and what time it is, if you're sick and you don't have an emergency, but, you're sick and you need to talk to somebody and you think you might need a prescription, you can literally press a smartphone app or call a number and they'll patch you in to a doctor, which in an average waiting time of about 16 to 20 minutes, you will speak to a doctor, a licensed, board-certified physician from the state that you're in, who will have your health records right in front of them, because it's part of the program is you fill out a health questionnaire up front, and they can they ask questions, they diagnose you, they treat you, and if you need a prescription, they can send that into a local pharmacy.
Jeff, what is the biggest challenge in the market with getting the consumer, the employees engaged in using the telehealth services?
Well, that's a great question because, if you look at I'll give you the good and the bad. The good is that the people who do engage, what you find is about 45% of the people who do call a doctor avoided a doctor's office visit. They were taken care of. About 35% avoided going to an urgent care, and about 8% avoided going to an emergency room and were treated. And out of all those people, they saved a lot of hours that they would have been away from an office. So, individuals and companies can save a tremendous amount of time and money when they use it. But like you said, there's a challenge because most telemedicine services come with consult fees, and because the public is not really aware of what telemedicine is yet. It's not mainstream. It's not like email or a cell phone. It's still a developing industry. A lot of people are reluctant to call a doctor for $35 or $40 when they don't understand what they're getting. And what if the doctor tells them, we can't treat you by phone, you got to go to the doctor. Now they've got to pay twice. So that's one of the challenges. And the other challenge is really education. And that's what our company tackles, both challenges, because our telemedicine program offers no medical consult fee. It's included in the package, so there's absolutely no barrier. There's nothing for anybody to lose to pick up the phone and try it. And two, we supply the companies, the employers, with a communication campaign to build awareness, because when somebody gets the benefit, if you got that benefit today and we're all excited about it, you may not get sick till next Christmas. By that time, chances are you forgot about it, unless there's an ongoing campaign going in which the company continues to remind you that if and when you get sick, there's a doctor, a phone call away. So that's a challenge.
Jeff, is your program going, looking at the employer and talked a little bit about the benefit, but what is the business model for employers? Are employers paying a per employee per month fee for this service? Or
That's exactly right. We mainly work through brokers. We don't do a lot of employer direct business, but depending on the group size, I'd say 90% of the business is employer paid 100%. So the employers, can look at it. We can show them the expected return on investment, what utilization they need to make it pay for themselves. But, typically, depending on employer size, they may spend $7 to $10 a month for a telemedicine package for their employees. And, if they get as little as 10 to 15% utilization, it's already making them money.
So, Jeff, you talked about the regulations earlier, being able to get a physician in your state. What are some of the barriers to the expansion of telemedicine? Because I think I understand on the Connect for Care issue that's developing at the federal level, one of the reasons that these ex-senators have gotten together is to try to unify regulations nationally. Is that a major problem? What other barriers might you have?
Well, it's something that has to be kept up with on a regular basis. So, the large telemedicine firms, they have people working full-time, constantly communicating with departments of insurance and state medical associations, because sometimes you have state medical associations that are very entrenched and they consider telemedicine as a potential threat. So we have to show them why we are actually encouraging people to have a primary care physician, and we offer them that we can send the health consult to their primary care physician, because that's what it's all about. It's not taking business away from doctors. It's encouraging people to get their yearly physical and things like that. So and legislatures could put out a notice that there's a change in telemedicine regulations effective 2 weeks from now. So you have to be on top of it. I know there's a bunch of telemedicine firms, popping up every week now. And I had a broker send me an email of a competitive firm yesterday who said they can't do business in Texas, Missouri, Louisiana, Idaho, Ohio, Iowa, and Oklahoma anymore. Well, because they thought they could, they weren't following the regulations right, and they got closed down. So it is a challenge, but the telemedicine firm, that we work with is on top of it.
So the guild wars have always been a problem. Everybody tries to protect their own turf. Much of telemedicine, it seems to me, also has been those the leading edge, if you will, or maybe it's the bleeding edge, going beyond the telephone and actually doing almost what I call concierge type services, sending technicians out with the telecommunication capabilities back to physicians. It seems like that's one of the potential areas of real competition with the existing doctors. And while we don't have enough doctors out there, it seems like they may still want to protect their areas. So are there certain areas of telemedicine that cause you concern or that you may be avoiding at this point?
Not really. In fact, where you say there might be challenges there in turf protection, you're also seeing like home health care firms, just like you said, where they will set up, equipment in people's homes. Hang on, shut that off. Where they'll set up equipment in people's homes, and they can monitor, so they don't have to send a medical technician out twice a day. They can monitor people full time, basically telemedically, and people can get their blood pressure checked and VO2 and things like that. All their biometrics are transmitted, and it's really telemedicine is what they're doing.
Right.
So it can save a lot of costs in the industry and give some of these, different companies a competitive edge to provide high-quality service for lower costs.
Yeah, it seems like from a consumer side, I mean, it's just a great area, and I really see this as a burgeoning area that really is going to benefit the consumer, that patient who wants services. We're so used to getting what we want when we want it right away. We don't want to have to go to the doctor's office. Somebody reminded me the other day, when you go to normal retail places where you walk in and you get in line, they call it a reception area. It's only in the doctor's office that they call it a waiting room. There's a good reason for that. What size companies are you selling to? Is this only for the large companies, or is there a way that smaller employers can access this?
We've got, we've got companies as small as 5 and 10 employees up to, we actually have a municipality with 4,000 employees. We're talking to several companies, large companies, with tens of thousands of employees. So, the applications are tremendous, and, some of the largest telemedicine firms are already entrenched in the Fortune 100 companies.
Right.
Amazon uses telemedicine, Google uses telemedicine, so, these companies have thousands of employees.
And
they just don't happen to be my clients, unfortunately.
There will be.
Jeff, but you and your brokers can work with your employer clients, and they can add this at any time throughout the year, correct? This is not just something that has to be added during open enrollment time.
That is true. First of all, it's not an insurance product.
Right.
It doesn't have to follow, any ERISA guidelines. It's not involved with COBRA when people leave work. So it's, I'll say it's under the American Affordable Care Act radar screen. It's just, it's an additional value-added benefit that an employer can add at any point during the year. And for that matter, they could discontinue at any point that they want.
Jeff, we've got about 30 to 45 seconds left. I want you to kind of tie this up and leave our audience with a couple good takeaways about HealthPERX.
Telemedicine is going to become commoditized over the years. Everybody's going to look for the cheapest way to have doctors available by phone. And what's going to happen is they're going to say they have telemedicine and nobody's going to use it. So the key is to work with a company who's going to help make their telemedicine program work. In our case, we say you eliminate the consult fee and you provide an awareness-building campaign. And just like corporate wellness, where you're trying to change behavior, this is what it takes to change people's behavior so that they begin to use it. Because once it begins to get used, it will go viral, and it will absolutely save healthcare costs, reduce absenteeism, increase productivity, save the employees money, and save the employers money. And that's what we do.
Jeff, I appreciate it. Let our audience know how they can get in touch with you, please.
They can go to our website, www.HealthPERX, PERX, the letter H, PERX.com. healthperx.com. All of our contact information is there, as well as information about our benefits, videos, and how to get a hold of us.
All right, Jeff, listen, thanks. Appreciate you being on the program today. You have a great weekend. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.